We're going to take a look at how we tell which antibiotic to choose to treat our patient with. So this is a really important concept, the MIC, which stands for minimal inhibitory concentration. So this is just the lowest amount or the lowest concentration of the antibiotic that will inhibit the growth of the bacteria. So we want to be above the MIC level at the site of the infection, and that will be able to treat the infection. So the other important thing to remember is that the lower the MIC that an antibiotic has, the more effective that antibiotic is going to be. So it's going to work better, and you're also not going to have to use very much of the antibiotic in the patient, which means the lower the dose you use, the less of a chance you're going to have it causing side effects with that antibiotic, which is good. 3 tests that a lab can use to determine the MIC for an antibiotic would be the BrothDilutionTest, the ETest, and the KirbyBauer diffusion test. And so once we know an MIC for a particular antibiotic, we can then determine whether that antibiotic would be good to use to treat that infection in our patient. Is the bacteria that the patient has going to be susceptible to the antibiotic, or is it going to be resistant? And then also it can help us decide on what dose of the antibiotic we need to give to the patient as well. In the broth dilution test, they take the patient's bacteria, put it in a broth culture media, put it in these tubes, and then maybe we want to test the antibiotic penicillin. So we would put different concentrations of penicillin in each of these tubes. So we would start off maybe with the lowest concentration on the left. We have 2 micrograms per mil of the penicillin. And then we get higher and higher concentrations until over on the right we've got the highest concentration of penicillin. We've got 32 micrograms per mil. And then we would incubate these tubes overnight, come back, check these 24 hours later, and then we check the tubes for growth. Where the bacteria are growing, the tubes will be cloudy. So we have growth in the first tube, we have growth in the second tube. But by the time we get to the third tube, you notice that it's clear. So there's no growth in this tube here in the middle. So where we first have no growth, that's going to be the MIC. So the MIC for penicillin in this case would be 8 micrograms per mil. So with the MIC for the penicillin, so you would get on your lab report, they say penicillin, they say the MIC is 8 micrograms per mil. And then they'd have a way in the lab where they could tell you if that would be susceptible, intermediate, resistant, depending on what levels you would reach in the body, depending on the doses that are given. And as long as you can reach above that 8 micrograms per mil at the site of the infection, then penicillin would work and would get rid of the infection. But if you can't get above 8 micrograms per mil above the MIC at the site of the infection, then you would not choose penicillin to treat your infection. It's not going to work. So you've got to be above that MIC level for the antibiotic to work and get rid of the infection. So a lot of times, instead of using those big tubes, they'll just put the patient's bacteria into these microwells instead. And then they will be able to test lots of different antibiotics in each of these rows going across. And we've just got the different concentrations of the antibiotics. We've got the lowest concentration here on the right, and then higher concentrations going over to the left here. The white dots indicate that you've got growth of the bacteria. So if you take a look at these different antibiotics, the lower the MIC means you're going to have a more effective antibiotic So if you look here, the antibiotic with the lowest MIC, the one that's going to be the most effective and that's going to do the best job, would be streptomycin. Because if you look here at the lowest amount of streptomycin, there's no growth. So you don't have to give very much streptomycin to get rid of the infection. And that's good because you don't have to give much of the drug. You don't run as much of a risk of getting side effects using that drug. Okay, and then the drug that has the highest MIC, and that would be the least effective, would be the doxycycline. So if you look here, even at the highest amount of doxycycline that you've got in that well, you still are getting growth of the bacteria. So the doxycycline is not touching this species of bacteria. Okay, it's not doing anything to inhibit its growth or kill it. So you would not want to pick doxycycline to treat your patient because it's not going to work. The bacteria are resistant to it. And then the kanamycin and the ethambutol on the bottom here. If we look here, the MIC levels would be somewhere here on the medium concentration range. And just depending on what those levels are, if you can reach above the MIC level in the body, then sure, they would be fine to choose to use and they would treat the infection. But if you can't get above those MIC levels, then you don't want to use those. They won't treat the infection. Okay, so the bacteria would be resistant to those. Another way to determine the MIC for an antibiotic is to do the ETest. So we'll take the bacteria from the patient's culture sample, put that onto a petri dish, and we'll put these ETest strips on the dish and grow that for 24 hours, come back. The antibiotic will diffuse out from the test strip and then kill the bacteria, and you'll get the zone of inhibition, this clear area. The test strip has different levels of antibiotic, and you can see that marked on this test strip on the bottom for vancomycin. And each of these strips have a different antibiotic on them, so you can test multiple antibiotics at the same time. And where that zone of inhibition crosses the strip, that's your MIC. So if we take a look at this picture on the bottom, where that zone of inhibition crosses the strip, you can see that our MIC for vancomycin would be at 1.5 micrograms per mil. So that means in our patient, we want the vancomycin levels to be higher than 1.5 micrograms per mil at the site of the infection to kill off the bacteria. And then the third way that we can determine the MIC is called the KirbyBauer disc diffusion test. So we'll just take the bacteria from the patient's culture sample and grow that in our petri dish. And then we'll place these paper discs with a particular antibiotic on it onto our petri dish. And we have a little spring-loaded machine here that will place the discs onto the petri dish for us. And this way we can test multiple antibiotics at the same time against this patient's bacteria. We'll incubate this for 24 hours and then come back and measure the zone of inhibition, the clear area around each disc. And the larger that zone of inhibition is, the lower the MIC is, and the better that antibiotic is going to work. So for example, if we compare this antibiotic here, where there's no zone of inhibition, to this antibiotic here, where there's a very large zone of inhibition, you would choose the antibiotic with the large zone of inhibition. That's going to work much better than the one where there's no antibiotic, or sorry, where there's no bacteria that have been killed around there. So what's happened is that closer around the disc, you've got a higher amount of antibiotic, and then as you move further away, the antibiotic levels get lower. And so you have a much lower MIC out here than you would, like, for example, on this one. This antibiotic would have a higher MIC because you're closer to that disc, so you have a higher concentration of antibiotic that's needed to kill the bacteria. So the larger the zone of inhibition, the lower the MIC, and the better that antibiotic is going to work. So this antibiotic would work better than this one, and definitely much better than this one, which didn't even kill the bacteria at all. So what we can do with this information is we will actually measure this zone of inhibition here. So they just measure that in millimeters. So maybe we measure this one up here, and let's say maybe that measures to be 22 millimeters. So then we go and take a look at our graph here, and for our particular antibiotic that we're looking at, let's say that maybe we're looking at amikacin. And for amikacin, let's say that we know at the doses that we give patients, we know that the level of amikacin will be somewhere between 7 to 28 micrograms per mil in the body. And if we know that on our KirbyBauer disc diffusion test, we measured a zone of inhibition against, maybe this was Staph aureus we were looking at from our patient. And we got a zone of inhibition of 22 millimeters. If we go up here and then we come over, we can see that our MIC here for amikacin would be about 1.8 micrograms per mil. And we know that amikacin, when we give that to the patient, we know that we're going to be at least 7 to 28 micrograms per mil at the doses that we normally give. So we're going to be way above the MIC for amikacin. So that means that the amikacin would work very well against Staph aureus. And so it would be reported out as being sensitive. So that would be a good choice for the patient to kill the Staph aureus and their infection. But let's say that maybe we had another antibiotic that we were looking at. Maybe we had some penicillin that we were looking at. And maybe for this one, when we measured that zone of inhibition, let's say here's our antibiotic disc. And maybe our zone of inhibition here, maybe when we measured that, maybe that was only 8 millimeters. Okay. And we would have, they actually have tables for this instead of a graph that you can just quickly look at to tell this, but you would have a different graph for each antibiotic. But let's just say that, you know, just to make it easy, let's just say that for penicillin, let's say we end up with the same level of drug in the body, which, you know, we probably wouldn't, but let's just say we do. And so if we have 8 millimeters as our zone of inhibition, and we go up here, whoops, and we come over, then our MIC for the penicillin is about 65 micrograms per mil. And we know that when we give penicillin, we're only going to be between 7 to 28 micrograms per mil in the doses that we normally give patients. So we know that there is no way that we're going to get above an MIC of 65 micrograms per mil in our patients. So penicillin would not be a good choice, because we're not going to get above that MIC to get rid of the bacteria. So on the lab culture report that you get back, it would have an R by the penicillin for resistant. Okay, and then maybe another antibiotic Maybe it measured, maybe it was at 16 millimeters of zone of inhibition, and it would fall here. Maybe its MIC is sitting at, maybe about 12 micrograms per mil. Well, that is in between where, you could be above that, depending on the dose of drug, but because you do have a range between 7 and 28, you could be at the low end, and you may not get above 12 if you're down here around 7. So that one we would list, maybe, I don't know, maybe we're looking at tetracycline or something. And so that antibiotic will be listed as intermediate, meaning that it might work, it might not. It just depends on the level of antibiotic, because it's kind of right in the middle. It's in the middle of that range, and that if you're on the high end of the range, you could be above the MIC, but if you're on the low end of the dose range, you may be below the MIC, and that antibiotic might not work. So that's the KirbyBauer disc diffusion test, and that's how they report out the results that you get back from the lab. They'll put the susceptible, resistant, or intermediate, and then clinicians can use that information to choose which antibiotic they're going to use to treat the patient's infection with. There are several factors that influence the effectiveness of an antimicrobial drug in the patient. The first one is the drug has to be able to reach the site of the infection to be able to work. And then each pathogen has its own susceptibility patterns to different antibiotics or antimicrobial drugs, so we have to look at that. And then we also need to make sure that the concentration of the antibiotic is above the MIC for that pathogen at the site of the infection. Let's take a look at the ability of the drug to reach the site of the infection, and this depends in part on how the drug is administered. So we can give drugs either orally, topically, or parenterally. Parenteral routes are injectable, so we can give drugs either intravenously, IV, or intramuscularly, or IM. Okay. So for example, if you have a patient with pneumonia, you would not choose to give the antibiotic topically, because there is no way a topical antibiotic would reach the lungs and treat the infection. So you probably would choose one of the parenteral routes, most likely, or possibly an oral medication. Another thing that can affect whether the antibiotic will reach the site of the infection is the condition of the tissue where the infection is. If you have blood clots in the area and that blocks the blood flow into the infection site, you're not going to be able to get the antibiotic in there. And if you have dead tissue, the antibiotic can't penetrate through dead tissue because there's no blood flow through. So you need to clean the dead tissue out of the wound first before the antibiotic can get in there. And then also remember biofilms. That slimy layer will keep the antibiotics from penetrating. So if you have a medical device, you need to take that out, get rid of that biofilm, and then start over again. There's a couple of factors that affect the concentration of the antibiotic that's reached at the infection site. So how much you're giving of the drug, the route that you're giving it, so maybe it's being given IV versus orally, the speed of uptake, so some drugs are taken up more rapidly than others, and also how fast it's eliminated from the body. That can also affect how often you're giving the drug, for example. So some drugs are cleared faster than others, so some you might have to be giving 3 times a day, whereas others you might only have to give once a day. This is just showing you the route of administration and the concentration of the drug. So you can see that by giving the drug intravenously in the red, you get the highest concentration the quickest. So depending on the patient, if they're in really serious condition, we definitely would want to choose the drug to be given IV because we can get high concentrations very rapidly. But those concentrations will very quickly decrease. So we need to give the IV route much more frequently than like if we were giving the drug orally. Oral administration, that's going to be the slowest uptake, and it's also going to be lasting in the body the longest as well.